Okay, so our presentation today is on the stigma and impact of HIV stigma on those living with HIV/AIDS. Today, we begin by understanding HIV/AIDS stigma, which encompasses negative attitudes, beliefs, and discriminatory behaviors directed towards individuals based on their HIV status. HIV/AIDS continues to be associated with drug use, homosexuality, and sex work, further reinforcing discriminatory attitudes and behaviors. HIV/AIDS stigma not only affects how people perceive themselves, but also impacts their access to healthcare and support services. One of the most detrimental effects of HIV/AIDS stigma is that it discourages individuals from seeking testing, disclosing their status, and adhering to treatment. This external stigma often leads to internalized stigma, thus compounding the issue. This impact not only brings harmful consequences to the individual, but increases rates of transmission within the community. HIV/AIDS stigma varies significantly across different cultures and societies. Research by Ruda et al. Highlights that demographic factors such as gender, sexual orientation, and geographical location can influence the prevalence and impact of stigma. Understanding the multifaceted nature of HIV/AIDS stigma is crucial for developing effective interventions. By addressing the unique ways in which stigma affects diverse populations, we can work towards reducing its impact and improving health outcomes for those living with HIV/AIDS.
The impact of stigma has multiple layers, including personal, social, health, and treatment impacts. An individual's mental health is impacted both emotionally and behaviorally due to stigma and discrimination. Emotional impacts can range from sadness and grief to depression, depending on the support or lack thereof one receives. Individuals may socially isolate due to shame or fear of rejection, as a real impact on relationships and social support networks is lost. Unfortunately, loss of relationships, employment, and other social networks is still a reality for individuals living with HIV. A systematic literature review by O'Grady et al. Discusses the impact of stigma related to mental health for individuals diagnosed with HIV and the roadblock stigma contributes to individuals accessing treatment. The systematic literature review emphasizes the need to tackle stigma and the social determinants of health in HIV prevention and treatment endeavors to merge mental health services with HIV care, improving the treatment outcome. Incorporating mental health care for individuals with HIV impacts the long-term quality of life, hopefully for the better. Anderson et al. Report that despite the advances in antiretroviral therapies improving the quality of health life, stigma still plays a major role in the overall quality of life an individual diagnosed with HIV, as evidenced by negatively impacting happiness, self-esteem, sexual and social relationships, and a sense of purpose. Anderson et al. Discuss how stigma and discrimination play a role in keeping someone from getting tested in a timely manner due to fear of being stigmatized and discriminated, thus delaying the start of treatment. Marks et al. Conducted research on women living with HIV, reporting less of a focus on women living with HIV than men when it comes to research literature. The women identified types of stigma and discrimination across the spectrum, from comments to looks, highlighting that subtle forms of discrimination are more harmful because they tend to come from people the women know. Sources include family, friends, intimate partners, medical providers and community, workplace, and the community in general. This study showed that women continued to deal with stigma and discrimination related to their HIV diagnosis and stressed the importance of a strong support system and education. Delayed testing and diagnosis are issues due to the impact of stigma and discrimination. The research shows that individuals delay accessing treatment due to stigma not only from social supports, but also from medical professionals. And then, after receiving a diagnosis, treatment is impacted by stigma and discrimination by not keeping follow up appointments or even dropping out of treatment. Obagu discusses how cultural beliefs can be so entrenched in cultural practices that they perpetuate myths about HIV and unfortunately reinforce some of the discriminatory behaviors.
Sierra, I'm not sure if you're muted.
I am so sorry. Relevant systemic, structural, and historical implications. A combination of societal attitudes, misinformation, and specific policies and laws influence HIV stigma in the United States. Where there are no laws explicitly supporting HIV stigma, specific policies and legal frameworks can inadvertently perpetuate it. 1. Criminalization of HIV non-disclosure. In many states, laws require people living with HIV to disclose their status to sexual partners and in some cases to needle sharing partners. Failure to do so can result in criminal charges, regardless of whether the person used protection or had an undetectable viral load, significantly reducing the transmission risk. These laws often do not account for current scientific understanding of HIV transmission, leading to stigmatization. Insurance and healthcare discrimination. Despite the protections of the Affordable Care Act, which prohibits insurance discrimination based on pre-existing conditions like HIV, there still can be indirect forms of discrimination. This includes higher insurance premiums or limited coverage for HIV-related healthcare needs. Employment discrimination. Although the American with Disabilities Act provides some protections for people living with HIV, workplace discrimination still occurs. Employers may have misconceptions about the risk of transmission or may not be fully aware of the legal protections in place. And there are also public policies that helps the stigma of HIV. Public policies can contribute to stigma, such as HIV reporting laws, which require healthcare providers to report the names of people diagnosed with HIV to the state health departments, can deter individuals from getting tested or seeking treatment due to fear of confidentiality breaches. Access to health care and disparities faced by people with HIV in the United States are influenced by various factors, which includes the socioeconomic status, race, geography, and the healthcare system itself. The socioeconomic status often lacks access to adequate healthcare services, including HIV treatment and preventative care. High cost of medication, lack of insurance, and transportation issues can impede access to necessary healthcare. Insurance coverage has improved. Access to insurance has improved, but the gaps remain. Some people with HIV may still face challenges in obtaining comprehensive insurance coverage that includes antiretroviral therapy and other essential services. Geographic disparities. Rural areas in certain states, particularly in the South, have fewer healthcare providers specializing in HIV care, making it difficult for individuals to access specialized services. And then the stigma and discrimination within the healthcare setting can deter people with HIV from seeking care. Negative attitudes from healthcare providers and fear of confidentiality breaches still contributes to this issue. Lack of cultural competent care. Healthcare providers may lack a training in culturally competent care for diverse populations affected by HIV, including racial and ethnic minorities, LGBTQ+ individuals, and people with substance use disorder, can lead to mistrust and reduced quality of care.
Moving forward, let's synthesize the current literature on HIV/AIDS stigma. The existing literature on HIV/AIDS stigma is extensive and provides valuable insights into how stigma affects individuals and communities. Key studies have shown that HIV/AIDS stigma significantly impacts health outcomes. For instance, a study by Earnshaw et al. Found that stigma is associated with decreased adherence to antiretroviral therapy, which in turn worsens physical health outcomes for people living with HIV/AIDS. Additionally, this data shows a significant impact on mental and emotional health. Another important piece of literature is the systematic review by Stengel et al., which examined various interventions aimed at reducing HIV-related stigma. This review highlighted several effective strategies, such as community-based education programs, peer-supported groups, and policy changes. These interventions have been shown to improve health outcomes and reduce stigma in various contexts. Existing research on interventions demonstrates promising results in reducing stigma and improving health outcomes. However, gaps remain in our understanding. One significant gap is the limited research on intersectionality and how overlapping forms of discrimination, such as racism, sexism, and homophobia, intersect with HIV stigma. Understanding these intersections is crucial for developing more nuanced and effective interventions. Additionally, there is a need for more longitudinal studies to examine the long-term effects of stigma and the sustainability of stigma reduction interventions. Most existing studies are cross-sectional, providing a snapshot in time rather than a comprehensive view of how stigma evolves and affects individuals over their lifetime. Another critical gap is the lack of data on HIV/AIDS stigma in rural and low-resourced areas. Much of the existing research focuses on urban areas and high-resourced areas, leaving a gap in our understanding of how stigma manifests and impacts individuals in different contexts. Addressing these gaps is essential for developing inclusive and effective strategies to combat HIV/AIDS stigma globally.
Attempts to address the issue. Significant public health campaigns targeting HIV/AIDS aim to reduce transmission rates, improve treatment access, and decrease stigma. Notable campaigns include the United Nations 90-90-90 target, which aims for 90% of people living with HIV to know their status, 90% of diagnosed individuals to receive sustained antiretroviral therapy, and 90% of those receiving treatment to achieve viral suppression by 2020. Other campaigns, such as the U.S. Department of Health and Human Services ended the HIV/AIDS epidemic, a plan for America focused on reducing new HIV infections by 75% in the next 5 years and by 90% in 10 years. Jones et al. Public health campaign have discriminated various levels of success. For instance, despite differing economic backgrounds, research in Botswana and Australia have made significant progress towards the 90-90 targets, highlighting the impact of concerted efforts and resources in achieving these goals. Community-based interventions such as decentralized services and task shifting to community workers have been particularly effective in low and middle income countries, showing higher uptake of HIV testing and treatment compared to facility-based services. Policy changes have been instrumental in reducing discrimination against individuals with HIV. Legislative efforts often focus on protecting the rights of people with HIV, ensuring equal access to health care, and eliminating discriminatory practices. For example, in the US, Ryan White HIV/AIDS program has provided a comprehensive system of care for those living with HIV, significantly improving health outcomes, and reducing stigma through community-based services. Policy changes have positively impacted public health by improving access to treatment and reducing stigma. Implementing anti discrimination laws and inclusive care policies has increased testing, treatment adherence, and viral suppression rates. However, challenges remain, particularly in regions significant social and structural barriers, necessitating ongoing advocacy and policy reform efforts to sustain and build upon these gains. Community-based interventions such as grassroots efforts often involve peer education, community outreach, and local support networks. These initiatives have been successful in promoting HIV testing, improving treatment adherence, and providing psychosocial support. Programs like the Treatment Action Campaign in South Africa have mobilized communities to demand better healthcare services and fight stigma. Community-led responses have significantly succeeded in various settings. For example, peer education programs in sub-Saharan Africa have effectively increased HIV-related knowledge and condom use, contributing to a reduction in new infections. However, challenges such as funding constraints and need for sustainable community involvement and the integration of community-led initiatives into national health system persist. Addressing these challenges is crucial for long-term success of community-based HIV intervention. Overall, a combination of public health campaigns, policy campaigns, and community-based interventions have shown promise in addressing HIV/AIDS epidemic. Continuing efforts are needed to build on these successes and overcome remaining challenges. A critique of what has been done. There have been successful strategies such as educational interventions that have been effective in reducing HIV-related stigma by increasing knowledge and correcting misconceptions about HIV. Programs that provide comprehensive information about HIV emphasize empathy and promote supportive attitudes have shown success in reducing stigma among various populations. Community engagement and empowerment initiatives have been successful in mitigating HIV stigma. Programs that involve community leaders and leverage peer support networks have been shown to foster supportive environment, reducing stigma and discrimination at the community level. And advocacy and policy for anti-discrimination laws and policies have been crucial in addressing structural stigma. Legal protection for people living with HIV have been effective in reducing workplace discrimination and improving access to health care. Some positive outcomes and case studies include South Africa, the implementation of community mobilization and educational campaigns led to significant reduction in HIV. These interventions improve community attitudes towards people living with HIV and increase the uptake of HIV testing and treatment. Another study in Thailand HIV program, which include comprehensive education, stigma reduction campaigns, and policy reform, successfully reduced stigma and discrimination. This program led to increased voluntary testing and better adherence to the antiretroviral therapy among people living with HIV/AIDS. Although there were some strengths, there are also weaknesses. Some ineffective approaches, such as one-off interventions are short-term interventions that shown limited effectiveness. Sustained efforts and continuing engagement are crucial for long-term stigma reduction. Programs that lack follow-up and reinforcement tend to have transient impacts. Top-down approaches, such as strategies that do not involve community input or fail to consider local context, also face resistance. Top-down approaches may be perceived as external impositions and lack community ownership, leading to limited success and changing attitudes and behavior. The ongoing challenges for HIV stigma includes the healthcare setting. People with HIV often faces discrimination and discourage them from seeking care. Socioeconomic cultural factors. Cultural beliefs continue to perpetuate the HIV stigma. Poverty, lack of education, and deeply ingrained cultural norms pose barriers to stigma reduction efforts. Comprehensive strategies must address these underlying factors to be effective. And policy gaps. Despite advancements, gaps in policy implementation and enforcement persist. Anti-discrimination laws and policy must be effectively enforced to ensure that they provide natural protection for people living with HIV. Additionally, there is a need for policies that address intersectional stigma faced by marginalized groups such as women, LGBTQ+ individuals, and racial minorities. Efforts to reduce HIV have achieved notable successes, mainly through education, community-based intervention, and policy advocacy. However, the persistence of one-off interventions, top-down approaches, and structural barriers highlight the need for comprehensive and sustained effort. Future strategies should focus on integrating community input, addressing healthcare system stigma, and tackling socioeconomic and cultural factors to create a more supportive environment for people living with HIV.
So some of the proposed solutions include having a client-centered model of practice, a health equity approach, as well as specifically the theory of respect and recognition, which offers some proposed solutions to help address HIV/AIDS stigma. The respect and recognition theory is from Darwall and Hanneth and describes the fundamental components that make up a just society. Darwall in 1997 describes the philosophy of all individuals being entitled to respect as a moral obligation. He describes two specific types, recognition and appraisal. Recognition is the understanding the worth of a dignity of other humans and therefore treating them in a manner that values them regardless of their characteristics. Appraisal, on the other hand, is the value given to others based upon their character development through specific achievements. Darwall, 1997. Respect and recognition for Hanneth, 1995, is relational as he recognizes human beings as part of society and everyone is interconnected with it rather than individual or autonomous actors. This means that individuals grow and understand themselves and others through their interactions and relationships. A just society involves a continual mutual affirmation of others through relationships. Not giving recognition and respect to others results in social injustice because it rejects the personhood of others and denies their claims to express themselves and be heard and acknowledged by others. Hanneth, 1995. Respect and recognition theory offers some proposed solutions to address HIV/AIDS stigma. These solutions include hearing and listening to the experiences of people with HIV/AIDS. This can be achieved through interactions in spaces that encourage them to share and allow for their experiences to be heard, recognized, and respected. This is done through creating events and spaces that facilitate community interaction and provide support for people with HIV/AIDS. This aligns with the theory's discussion of the importance of mutual interaction and affirmation of all persons. Darwall, 1997, Hanneth, 1995. There also needs to be a continual process of advocacy to ensure people with HIV/AIDS receive equal access to all aspects of society, including healthcare, housing, employment, and social services. This type of advocacy reflects the recognition and interaction required by all persons in all aspects of society, as the theory requires. Darwell, 1997, Hanna, 1995. Additionally, open conversations and education need to be provided to communities to allow for improved recognition and respect for people with HIV/AIDS. Finally, individuals with HIV/AIDS need to be provided with the psychological and social support they need to gain the recognition and respect they are entitled to as valued members of our society.
Application of theory in social work practice. Social workers have an ethical obligation to combat stigma and discrimination, ensuring individuals with HIV are recognized and treated with respect and dignity. Obegu discusses the importance of cultural competency training, including non-judgmental and culturally sensitive care, to create a supportive environment that promotes self-respect and self-worth. The National Association of Social Workers, also known as NASW, provides cultural competence training and education through the NASW HIV/AIDS spectrum. NASW has a national HIV/AIDS strategy, and it highlights the need for social workers to support the implementation of federal agencies such as the U.S. Department of Health and Human Services, Substance Abuse and Mental Health Services Administration, Centers for Disease Control, and the Health Resources Services Administration. Gates et al. Discuss how the U.S. Department of Health and Human Services, HHS, is addressing the intersectional stigma and discrimination related to HIV prevention and treatment options for individuals diagnosed with HIV. HHS has launched the Ending the HIV Epidemic in the U.S. Initiative, the EHE, aiming to reduce new HIV infections in the U.S. by at least 90% by 2030. The goal of the EHE is to provide equitable services as access to currently available resources remains inequitable among demographics, regions, and communities. HHS, through the EHE, is promoting federal agencies to take a more active stance against intersectional stigmatization by identifying agencies to partner with, creating policies to address those not being serviced, creating a monitoring system, and integrating various interventions to address intersectional stigma. Social workers play a vital role in reducing the stigma and discriminatory practices toward individuals with HIV. Training social works and colleagues from their other disciplines is vital to incorporating cultural competency care into their practice. Obegu stresses the importance of training all healthcare workers to provide non-discriminatory care and advocate for an inclusive treatment environment.
Overall, HIV/AIDS stigma is an important topic to address both at the local and national level because it impacts access to healthcare and support services for individuals living with HIV/AIDS. Social workers and healthcare workers can impact stigma through providing a client-centered approach and culturally sensitive care. Respect and recognition theory can help frame the conversation and combat stigma through acknowledging mutual affirmation and recognizing the value of all humans. Community action, education, and advocacy are important for addressing this issue through collaborative and integrative approaches to improve health outcomes and quality of life for individuals living with HIV/AIDS. Please review your brochure to learn more and how to take action to help end HIV/AIDS stigma. Thank you.